What is going on with Donald Trump's hand? I'm a board-certified dermatologist who sees things like this in the clinic all of the time, and I'm going to give you my breakdown today. Now, I am covering this story because it is of public interest and not because I endorse any political candidate or their ideas. If you question that, you can always go back and look at the video I did on Joe Biden and his skin cancer history. So why would he be wearing concealer on his hand? And seriously, who can't help him match the color a little bit better? So he's got a bruise on the back of his hand due to shaking hands with so many people as President of the United States, and many people are not buying this story. When we look closely at this photo, there's a pretty well demarcated area of where the concealer is. But if we look at this as a clock face, right over about 3 o'clock, there does appear to be a growth or a lesion here. Now, I see things like this on my patients all of the time, and I can't tell with certainty from a picture at this resolution. Seeing it in person would make a lot easier the diagnosis, but a lesion like this on the back of the hand would certainly be consistent with a precancerous growth on the skin called an actinic keratosis. Or if it were more advanced, it could be a type of skin cancer called a squamous cell carcinoma, probably a subtype called a keratoacanthoma. These commonly appear in sun-exposed areas on the arms, the hands. We see them commonly on the legs, not as much on the face, however. These are rapidly growing types of skin cancers, and although they grow rapidly, they don't tend to be very aggressive. They have a very low rate of metastasizing and going inside the body. Now, the president is apparently shaking hands with tons of people, and when we look at a picture of him shaking hands with Keir Starmer from the UK, we can see that the hand is being stretched there. Let's talk about the effect of collagen loss with aging. As we age, after about the age of 25 to 30, we start losing about 1% of the collagen in our skin per year. And collagen is what makes our skin have its thickness and resiliency, along with another molecule called elastin, which gives our skin its bounciness and the ability to return back to normal. Now, when you lose collagen in the skin, that is also the padding and the protection around the other structures in your skin. So looking at the way his skin is being stretched, if you don't have a lot of collagen to protect the blood vessels, it doesn't take much to get bruising, and he is 78 years old. When you get that old and you've lost so much collagen in your skin, not to mention the amount of sun damage that he has had out on the golf course all the time, you're not going to have a lot of collagen in the skin to protect the blood vessels. So the explanation that shaking hands has been causing this bruising is completely plausible to me, because that stretch on the skin from that handshake with Keir Starmer, that is enough to cause bruising in many elderly people. And he's doing this dozens, if not hundreds of times a day, depending on what his schedule is. And so I think some of the speculation that this is due to an IV site insertion or something more nefarious like a cancer or metabolic heart disease that people are talking about, I just don't necessarily think it has to be that severe. The simplest explanation oftentimes is the most reasonable. He's a 78-year-old man who's been in the sun a lot. At 78 years old, you would have lost a lot of collagen. And I have patients every day in my clinic that say, if I just barely bump into the doorway or I breathe on my skin the wrong way, I will bruise. It can be that easy. So the official explanation from the White House, I think, is pretty plausible. Let's go back to that little bump on his hand, however, this potential precancerous lesion or potentially a squamous cell carcinoma, the keratoacanthoma type. When you have a bump growing on the skin like that, it is subject to trauma. Every time you're putting your hands in your pocket, it's going to rub. And with chronic damage like that, bumping on this lesion, that in and of itself could also lead to bruising. So in my opinion, I think President Trump needs to get this little bump on his hand looked at. In his most recent official physical, they did note the development of precancerous skin lesions called actinic keratoses that they were present on his skin. Now, they didn't tell us where that was at, but again, in a golfer, he's often wearing a baseball cap. You know the type. I don't have to explain it. So his ears are not protected, and that's a common spot for precancerous growths to develop. We didn't get the exact location, but we know, based on official records, he has a history of actinic keratoses, and I think this lesion on his hand is consistent with that at a minimum, if not already a keratoacanthoma, which is a subtype of squamous cell carcinoma. So for all those that are speculating about more nefarious causes of the bruising on his hand, I just don't think it's necessary to go down that rabbit hole. He shakes hands with a lot of people. He obviously has very thin, frail, fragile skin and a lot of UV exposure, enough to develop precancerous cancerous skin lesions, if not a skin cancer. No research that I found showed that he has a history of skin cancer personally, but I question that now based on what I see on his hand. He may not have it yet, but the diagnosis may not have come. So that is my assessment of all of this buzz from a board-certified dermatologist about the bruise on his hand. Why he wants to cover it up, that's personal reasons. There's plenty of evidence of presidents throughout our history that are covering up minor and major health conditions. So the fact that they may not want things to be in the public eye is not surprising, regardless of what you think of that. He's not the first president to hide potential health problems from the public. So Trump has a bruise on his hand. He's covering it up with poorly matched concealer. Somebody needs to help him out with that. That is my breakdown. If you guys want good concealer for the body, whether you want to cover up tattoos or bruises, there's much better options that you can find at Sephora. Dermablend is the brand that I recommend, and I'll have a link to down in the podcast show note. If you're trying to recover some collagen in the skin, vitamin C drops and a retinol body lotion, along with a collagen supplement like Vital Proteins are my recommendations, and I'll have links to those products down in the video description as well. Thank you for tuning in, and I'll see you guys on the next video.